Everybody, Dr. Rocco here again from Springs Family Chiropractic to give you some more great health tips for the week. Today I want to talk to you about searching for good chiropractic care and some of the myths that you may hear from some of the general public or family and friends that may skew you off track of getting good care for yourself and your body. One of the first myths that you hear a lot of times is that you will need to get a adjustment treatment 2 to 3 times a week for the rest of your life. And that is a myth in which you can go to several chiropractors and learn that they will offer you several different types of techniques. One of the differences between a lot of chiropractors is that they have a passion in which they want to practice. Some of them may foresee a condition that you have pre-existing, some arthritis. It might take them 2 or 3 months to get into control, and then you feel no effects from it. But some, like our clinic, believe in dismissal care, in which we can have the patients do an active role in their care, doing exercises, nutrition, other emotional stress management type activities to get their body to the state of wellness faster. And so once we get them to wellness, then we can dismiss them, in which then when something new occurs in their life and they have problems, they have the education that they know they can go back to a clinic and get care. But once again, you do not have to get care for 2 to 3 times a week for the rest of your life, because that may be too much for your system and you will develop other problems from that, in which you can talk to your chiropractors about. A second myth that you will hear commonly about is chiropractors can cause strokes for individuals. And that is a very large myth that all of the chiropractic colleges that offer doctorate programs go over extensive research for their doctors in training and their graduating doctors that offer care to their patients, that there's no increased risk of a chiropractic manipulation for an individual versus an individual just going to a general doctor for a physical exam. Dr. David Casey did a study in Spine, the journal Spine of 2008, last year, that indicated and showed that there is no increased risk by any chiropractic manipulation versus any other type of care by other health practitioners. So for patients with that concern that they can get a stroke is basically far from none. There's always a risk with any type of healthcare treatments that you can get. That's taking a prescription, that's getting surgery, that's getting even any kind of physical activity. So the idea for you is to get the best preventative education you can from your chiropractor or health practitioner to learn, how can I prevent strokes? And we can offer a lot of stress management and nutritional and chiropractic treatments to help patients with that. The third area of myths that you may run into for chiropractic care is commonly that patients say they get addicted to the cracking and popping of the joints, or the chiropractors just like to make patients crack and pop their joints. And the reason why that is a myth is because anytime you may hear a pop or crack from a joint, that is a release of nitrogen and air coming out of the joint capsules themselves, in which it's just a buildup of metabolism and physiological reactions in the body. The chiropractic doctor is truly looking for a correction of biomechanics and the nervous system to be de-stressed and a subluxation to be removed. And a subluxation is going to be an area of joints that are causing interference with the nervous system, allowing it to not communicate properly with the rest of the body. It could be muscles not communicating with the brain. It could be organs not communicating with each other. It could be just normal cells in your skin not communicating. So that's the primary role of the chiropractor, and there's many techniques that can treat patients that they will never have any cracking or popping, so they'll never have to worry of any of that concern if that's a disturbing thing for them, that you can talk to your doctor about that. And if you have any questions or requests that we can help you with for your care, just check us out on our website at www.springsfamilychiro.com.